Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. Leslie Sims of the Sims Center in Las Vegas, Nevada. Dr. Sims is board-certified Las Vegas ophthalmologist. Dr. Sims has been named one of the top doctors in Las Vegas by Desert Companion magazine. Dr. Sims provides quality and innovative reconstructive and aesthetic surgery and non-surgical procedures of the eyelids and surrounding facial structures. Welcome, Dr. Sims.
Good morning.
Dr. Sims, please tell our viewers a little bit about yourself in your practice in Las Vegas.
Well, I relocated here from New York about 3 years ago, and I opened this practice about a year ago. I'm a fellowship-trained oculoplastic surgeon, which means I've had additional education and training in plastic surgery and reconstructive surgery for the eyelids and surrounding facial structures. Our practice is both aesthetic as well as reconstructive, so we can deal with a wide range of patients. Oculoplastics is a profession that is very specialized. There are about 500 of us in the country. There are only 3 here in Las Vegas. And that's our practice.
Well, let me ask you then, if you could elaborate for our viewers, as an expert and someone who's been in practice for 15 plus years, what advice would you give someone that's looking for an eye or facial plastic surgeon in the Las Vegas area?
Well, I think an educated patient or potential patient would look for a credentialed surgeon. And when I mean credentialed, meaning a surgeon that practices within their scope of expertise and training. Just because someone says they're a facial plastic surgeon or a facial surgeon does not necessarily mean they've been trained as such. So that's something that the patient should be very careful of. Also, the patient needs to have a good discussion with the clinician surgeon about what the expectations are, what their needs are, what is reasonable, what is not reasonable, and therefore they would have a very clear understanding going into the procedure or treatment of what to expect.
As a very highly trained facial plastic surgery, having gone to both Harvard and Yale, could you tell our viewers what's the 2 most common procedures that you perform in your practice?
Well, especially for a facial oculoplastic surgeon, our bread and butter are blepharoplasties, or what's called an eye lift, upper and lower, removing fat pads or that give you the sagging look in the eye. And also I do a lot of ptosis surgery, and that's when the muscle of the upper eyelid is no longer functioning well and you have to go in and strengthen it. But we also do a lot of reconstructive work where the eyelid turns in or the eyelid turns out. We deal with the tear duct. When people have tearing problems, sometimes the tear duct is clogged and has to be opened. That's a surgical procedure. I also deal with eyelid skin cancers. I work in conjunction with dermatologists who do something called a Mohs procedure, and they remove the tumor in its entirety, and then I do the reconstruction.
Well, let's talk about any one of those procedures, just because I know that some people might be concerned with the pain that might be involved, or even the recovery time, how long it would maybe take somebody to get back to work. So could you kind of talk to us a little bit about that?
Well, each procedure comes with different set of issues. Say the blepharoplastic procedure. There's very little pain with that. You're given an monitored anesthesia care. I also give a local infiltrative injection on the lid. The surgery is performed. The patient goes home the same day. The first 48 hours are probably the most important, in that the patient really needs to follow the post-op instructions that are given to them at the time of their procedure. Ice is something that's required. Black and blue, well, you will be a little black and blue. However, I offer my patients a homeopathic remedy called Sanit, otherwise known as Arnica montana, and that helps with bruising and swelling, and I'm telling you, it really works, and the patients are always very grateful about that. In terms of downtime, there's a social downtime and then a functional downtime. Functionally means we don't want you overexerting yourself, and so we put parameters on that. Social downtime is generally to the patient's, that's what the patient decides for themselves, i.e. going to a function, going out to grocery shop, In a lot of ways, you can camouflage with makeup or wear sunglasses, and some people just don't care. So we have that discussion usually at the preoperative visit.
Well, let's say that someone is thinking about having a facial procedure, and they've never been through the process before. Can you talk to our viewers a little bit about what would it be like when somebody comes in the door at your practice, and what would be the experience like once they get started with the process?
Certainly. Once the patient makes their appointment and we determine what it is that they want to discuss in consultation, they come to my office and they meet with our front desk. I have a very lovely front desk. They do the paperwork. A lot of times you can get the paperwork off our website if you so desire and have that filled out before you come in to save some time. Once that paperwork is filled out, they meet with me in my exam room, and then I do what I call housekeeping. I just kind of review everything, their past medical history, past surgical history, allergies, medications, family history, social history, just to make sure we have everything on board. And then we have a discussion on what it is that the patient is interested in pursuing. So then we have a discussion about that, the pros and cons, is it appropriate, what to expect. If it's a surgical procedure, they then have to have a pre-op visit, meaning that they will come back and see me, sign informed consent. Again, we go over the risk, benefits, and alternatives to the treatment, and the patient then asks any questions that they may have. I always tell patients to write questions down because they tend to forget, and it's great if they come with someone in their family, because another set of ears is always good, because sometimes you don't hear, patients sometimes don't hear everything you say. So that's always good if you can come with somebody. And then once the procedure is scheduled, the patient is given instructions. Again, if it's a surgical procedure, where to go, when to get there, how to get there, what time to get there. I let them know how long the procedure will be, roughly, and let them know what to expect in the postoperative management of their case. And then they have a postoperative visit, generally 7 days after the procedure, where usually I'm taking out sutures at that time, and the patient will be aware of that. So that kind of takes you from the beginning to basically the first postoperative visit.
I understand. Well, again, let me talk more generally. As an expert in the field, for someone who's looking to have a procedure done, in your opinion, what's the most important thing that someone should look for in a facial plastic surgery procedure or experience?
Well, as I said before, a credentialed surgeon, one who's had the appropriate level of training, one who's interested in safety, also interested in results. Especially with our types of surgery, you want to have as much of a natural result as possible. In fact, our tagline is refresh, rejuvenate, restore, results. And that's what we try and impart to our patients. And if the patient is coming in for a procedure, it's important that we talk about the safety, efficacy, and the science behind any procedure.
I understand that you take very good care of your existing patients, but I'd like to talk a little bit now about a new patient, someone who's never been to your practice. Are you currently offering anything to new patients?
You mean new procedures?
Someone who's never been to your practice. Do you have any incentives that you're currently advertising?
Oh, yes, we do. We have them on our website and in our newsletter. We are giving 10% off all our facial care line. We have a medical grade skincare line, 10% off of our injectables, which would be the standard Botox, Xeomin, Dysport. Of course, we do Radius, Restylane, Juvederm. So we do offer that to the new patient.
So you also have a skincare line as well?
Correct. Mm-hmm. And it is a medical grade skincare line. We have a cleanser. We have a hydropeptide gel, which helps with fine lines and wrinkles and moisturizing the skin. We have a lactic acid, which is good for brightening the skin. We have sunscreen. We also have a mini peel that we do to get rid of the brown spots. You can even peel your hand. A lot of people do that. We also have a PCA Retina A eye gloss to help with fine lines, wrinkles, and discoloration.
Dr. Sims, I would like to thank you for being on this interview. You've given our viewers a lot of very good information, not only on facial plastic surgery, but skincare as well.
Oh, thank you.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been talking to Dr. Leslie Sims of the Sims Center in Las Vegas, Nevada. If any of our viewers would like to get more information from Dr. Sims, please refer to the phone number at the bottom of the screen.